Hello, my dear students. This time I am going to discuss with you few disorders of the bones like osteomalacia, osteoporosis, osteomyelitis, osteoarthritis, osteopenia, osteosarcoma, osteogenesis imperfecta, osteophytes. The names look to be similar to each other slightly, but they are different disorders, different to each other, and these are important for UG university examination as well as PG entrance examination. I will not go in detail of all these, but I will discuss the differences between all these, the salient features and the causes. So let us start. First is the osteomalacia. Osteomalacia is because of deficiency of the calcium. Particularly, this is the metabolic disorder that causes us to soften and weaken the bone. Hence, it is also known as the soft bone disease. It is mostly because of the deficiency of vitamin D. So there is deficiency of vitamin calcium and phosphate. So deficiency in the vitamin D or calcium phosphate, that is the most important cause of the osteomalacia, and it is the counterpart of the rickets. Rickets is the children and osteomalacia in the adult. So deficiency in the vitamin D, calcium phosphate, this you have to remember for the osteomalacia in adult. It is counterpart of rickets. Bones become very soft. These are the healthy bones with the healthy density, and this is the osteomalacia, bones weakened, bone density. Symptoms include bony pain, muscle weakness, difficulty in the walking, and increased risk of fractures. Treatment for osteomalacia usually includes the use of supplements containing calcium, phosphate, vitamin C. So this part is important, deficiency of vitamin D, calcium, phosphate in adult stage. Second is osteoporosis. You can see here it is because of the hyperparathyroidism and long-acting because of the long-acting steroids. So bone resorption is more, removal of the calcium from the bone is more, and new bone formation is less. That is important. This is the high density healthy bone. This is the low bone density in the osteoporosis. This is the healthy spines. These spines with the osteoporosis showing compression fracture sometimes. This is the spine. This part is seen here, healthy bone, and this is the osteoporotic bone. This is the porous bones, the very weak bones. Osteoporosis is the disease characterized by thinning of the bones with a consequent tendency to sustain fractures from minor stresses. Osteoporosis is the most common metabolic bone disease. Its name literally means porous bones. There are many pores in the bones. This disorder is most common in the post-menopausal women of the age of the 50 years, again due to deficiency of calcium. For these women, fracture is the leading cause of morbidity and mortality. So osteoporosis, you can remember, is porous bones because of some metabolic disorders. The body constantly absorbs and replaces bone tissue. In osteoporosis, new bone formation does not keep up with the old bone resorption or removal. Bone resorption is more, bone formation is less. Causes due to calcium deficiency persisting for the long time. Hyperparathyroidism, again, hyperthyroidism, bone resorption is more. After prolonged intake of the steroids, treatment includes medication, a healthy diet, weight-bearing exercises to help prevent bone loss or strengthen the already weak bones. Now come to the osteopenia. It is the previous stage of the osteoporosis. You can see here healthy bone density, then mild bone density, osteopenia, then severe bone density, osteoporosis. Osteopenia may be converted into the osteoporosis. So loss of bone mineral density here, body does not form new bone as quickly as it absorbs or resorbs old bone. Similar causes of the osteoporosis, this is osteopenia. Causes deficiency of calcium due to low calcium diet, smoking, age-related hormone changes, and certain diseases and medication. Women are mostly at the risk. Typically, no symptoms unless condition progress to osteoporosis. Then there will be back pain, loss of height, a stoop posture, and easily fractured bones. Stoop posture is kyphosis, forward bending. This is the normal posture. This is the stoop posture, forward bending of the vertebral column, and a slightly curved back Here, stood posture. Treatment include similar treatment almost of the all the disorders we are discussing here. Treatment include medications to protect the bone mass, dietary changes, supplementation, and exercise. This osteomyelitis, this is the inflammation and infection particularly. It is the inflammation of the bone tissue caused by infection. This is the osteomyelitis bone infection. A sequestrum is infected dead bone here, nidus of the infection. This is resulting from the osteomyelitis. Osteomyelitis in the femur here shown. This is the osteomyelitis, and this is the infected area involucrum, and you can see here with the help of the lens. Particularly, this due to bacteria Staphylococcus aureus. This is osteomyelitis. When so it is itis, so it is the inflammation. The condition most commonly caused by the infectious organism is Staphylococcus aureus, which reaches the bone via the blood stream or by extension from a local injury. It generally involves legs, arms, or spines. The bacteria enters the bone tissue from trauma, ischemia, or the presence of foreign bodies. Osteomyelitis, the infected bone sites are usually exposed and pus may come out. Symptoms of the inflammation like pain, fever, tenderness, redness, hot or warmth, swelling, restriction of movements. These all are the features of the inflammation. Sometimes the pus may come out from the bones. Treatment is usually surgery to remove the dead portions of the bone, followed by antibiotics by intravenous route for at least 6 weeks. This is osteomyelitis. Now come to the osteoarthritis. This is the inflammation of the joint and involving the cartilage particularly. Disorder of the joints characterized by progressive deterioration of the articular cartilage or of the entire joint, including the articular cartilage, the synovium joint lining, the ligaments, and the subchondral bone, the bone beneath the cartilage. This is normal joint, femur, tibia, and fibula. This is osteoarthritic bone joint. This is the cartilage. This is the exposed bone. Cartilage to begin breakdown. Eroding sinus is there, and bone spurs. Bone spurs. This is the osteophytes. The bony grows at the edge of the bone. Osteoarthritis is the most common joint disease. Most common joint disease. The joint pain in the hands, neck, lower back, knees, or hips. Treatment almost the similar treatment. Medications, physiotherapy, and sometimes surgery can help in reducing the pain and maintain joint movement. Next is osteogenesis imperfecta, OI. Osteogenesis imperfecta, this is a hereditary disease due to genetic defect. Osteogenesis imperfecta is the rare hereditary disease of the connective tissue, characterized by the fragile or weak bones or brittle bones that fractures easily. These are very weak or brittle bones, osteogenesis imperfecta, due to genetic disease. It is caused by the defective genes. Osteogenesis imperfecta arises from the genetic defect that causes abnormal or reduced production of a protein called collagen, a major component of the connective tissue. So, hereditary disease of the connective tissue. Symptoms, it can be mild with few fractures in whole life, but it can also involve hundreds of fractures without any apparent cause. Treatment include bone strengthening by medication, physiotherapy, and orthopedic surgery. Then osteosarcoma or osteogenic sarcoma, this is a tumor or cancer, a type of the bone cancer that begins in the cells which form the bones. This is tumor. This is the knee joint tumor. Osteosarcoma tumor is here. You can see here. This is the tumor portion. This is the tumor portion. The femur, tibia, fibula. It most often occurs in the long bones of the arms and the legs, although it can occur in any bone. It tends to occur in the children and young adults. Symptoms: localized bone pain and swelling. Treatment: surgery, chemotherapy, and radiation. Anti-cancer treatment. Then osteophytes or bone spur. This is a bony growth that develops on the edge of the bone, like here. This is the Ankle joint and this is the calcaneus bones, and at the edge of the calcaneum bone this is the bony spurs or osteophytes. This is the bony growth. Sometimes may cause the pain. This is knee joint and these are the marginal. Sorry, this is the central osteophytes in the center bony growth. These are the marginal osteophytes. The bony growth at the margins of the tibia here is shown. These are often found when the bones meet each other, like in the joints and the spines. Sometimes causes symptoms like the pain. Treatment includes non-steroidal anti-inflammatory drugs or muscle relaxants to ease the discomfort. Spinal injection can also provide the some relief. Physiotherapy and exercise program may also be helpful. So these are similar looking disorders the bones. Osteomalacia because the vitamin D deficiency in the adults, counterpart the rickets. Osteoporosis, porous bones due to hyperparathyroidism and use of long use of steroids, and due to vitamin D and calcium deficiency, particularly porous bones. Osteomyelitis is the infection and inflammation. Sometimes pus may come out from the bone due to Staphylococcus aureus. Osteoarthritis, a joint disorder, and particularly the cartilage is destroyed. Osteopenia is previous stage the osteoporosis, again porous bones. Osteogenesis imperfecta is due to defective genes, and then osteophytes are abnormal bony growth at the margins or at the center of the bones. So these are a few disorders of the bones important for the university examination, PG entrance examination. So I stop here and just you go for the reading. These are important for the MCQs for the Viva point of view also. Thank you very much.